Chapter 54, Dental Health and Genetics. And this is specific training for the periodontitis sensor. And now let me first explain the concept of periodontitis. In our gums, this is a cross-section of a tooth. There's the bone holding the tooth, and that's the gums. There is a constant fight between bacteria and our immune system. So bacteria invade the tissue, and the immune system fights them back. Usually this is a constant battle. However, it's not a very aggressive attack. It's not a very aggressive response. And there are a number of genes, the TNF-alpha genes, IL-1RN and interleukin-6 genes. And these genes modulate the aggressiveness of the immune system. So when they are all working correctly, the immune system doesn't respond too strongly and everything is okay. However, in periodontitis, it's again the immune system that is causing the problems. So genetic variations in these genes make the immune system too aggressive. So while the bacteria invasion into the tissue is moderate, the immune system starts to counterattack much too aggressively. And this causes inflammation of the gums, of this area. And if this persists for a long time, it starts to degrade the bone. So it starts to reduce the bone tissue until the tooth can fall out. So periodontitis is damaged by the immune system. It makes the teeth come loose and then they eventually fall out. And this is a screenshot from one of the reports. In case you haven't seen this before and you don't know what it means, I would really recommend that you watch the training of simple disease risk statistics. I will explain it all to you. But this here is the IL-1RN, interleukin-1 receptor gene. This is what it does. 6% have the CC type with no increased risk, and 47% have a 3.4-fold risk of periodontitis. And these here are the scientific studies behind it. This is the next gene. So 32% have an increased risk, odds ratio of 1.89. Again, if you don't know what an odds ratio is, the training for simple disease risk statistics are going to explain it to you. And so on, that's the IL-1A, 10% would have a 1.73 increased risk and a 5-fold risk. And this is just for titanium implant loss, which is another training. So I'll skip over this. All right, so this is all very scientific and statistical stuff. I usually wouldn't talk to patients about this much detail of the science behind it. I would say this is for experts that want to find out about it. In a simplified manner, it is shown here. So the risk of periodontitis, this is how it is in the report. The risk might be normal or it might be very increased, and this person is sort of in the middle area. So they see on a scale of how high their risk is and how important the preventive measures that we would recommend to them are for them. If it's in a normal range, it's less important. If it's an increased range, it means that they are at a much higher risk of experiencing tooth loss due to periodontitis. And that then means that they need to follow the prevention more thoroughly. And the prevention is very easy to understand. So I would recommend, if you ever get a report into your hand, just read through it and you will see that it's very simple to understand. I'm just summarizing it. For one is have particular attention to oral hygiene. So thoroughly brush your teeth with good toothpaste and good toothbrushes. Go to dentist checkups every 3 to 6 months. So we would recommend it more often than we would recommend it to people with low risk. Then there is professional oral hygiene. So a professional would use certain tools to clean plaque of teeth, and this should be done more often if you have a higher risk. And then there are other risk factors that play a role. So for example, smoking increases the onset and the aggressiveness of the immune system. Then dental caries or poor oral hygiene as I said, is a risk factor. Mouth breathing or teeth grinding is a problem, so this should be put under control. And piercings in the mouth, so metal objects that constantly hit against the teeth, are also to be avoided if you have a high risk. That's the end of chapter 54, dental health and genetics as training for the periodontitis sensor. There's another aspect of dental health, and that is titanium implant loss, which is influenced by genetics. And this is a separate training that I would also recommend that you can watch concerning this topic.